Endophthalmitis is one of the more severe infections that can affect the eye, and it affects the inside of the eye. The most common symptoms are pain and vision loss. Pain usually is pretty severe, and the vision loss can also run the spectrum, but it can be pretty dramatic and severe as well. What a patient may even notice on their own if they were looking in the mirror, for example, is if the eyes just looks very angry, it's very red, inflamed, and swollen. The rates are very, very low. Most of the procedures that we perform have rates in the order of 1 in several thousand patients. We're looking for some inciting events. So, for example, if a patient recently had a cataract surgery, or if they had an injection into the eye, or some procedure around the eye, that could introduce bacteria or some other infectious agent into the eye and cause an infection. Usually around 1 to 3 days, the patient's had a procedure or an injection, and then all of a sudden their vision may get worse and they start experiencing very severe pain. And the other time that we see this is if somebody's really, really ill and they have some sort of infection affecting their body that then travels to the eye. It's really piecing those puzzles together and figuring out, does this clinical picture look like endophthalmitis? Time is of the essence in those cases, getting that treatment in early and continuing to make sure that that treatment is working effectively. And it is a fairly fast progressing disease. It's very important to get in to see your ophthalmologist or retina specialist so that you can diagnose this early. Medications that we take by mouth often can't get into the eyeball itself, so we have to do an injection of antibiotics, and sometimes we also do a steroid for the inflammation. And then we kind of see how the patient does. We follow very closely. We have the patient usually come back the next day, and then we decide if we need to escalate care, meaning do we proceed to surgery and actually clear out that infection with a surgery that we call a vitrectomy, or we may just continue to observe and see that that infection and the inflammation is improving after that initial treatment of antibiotics. The other important component in terms of endophthalmitis is figuring out what type of infection may be affecting the eye, because different types of infections have different treatments. In most cases, it's a bacterial infection, but sometimes you can have a fungus or other source of infection. So it's really important to be able to differentiate. The way we do that is at the same time we do an injection for antibiotics in the eye, we take a sample of the fluid within the eye and we send that for a culture. We also have different DNA analysis and RNA analysis techniques as well that are on the cutting edge that may give us an answer more frequently, because the cultures don't always give us a positive identification, and they also may give us a faster result. So we're improving in that regard as well.